Hello, I'm Dr. Pat Mallory. Welcome to the practice. I'd like to take a few minutes to talk to you about regenerative injection techniques, what we call RIT. These are 3 different injection techniques that we use to treat ligaments and joints in patients who have chronic pain from ligament or tendon injuries or joint injuries that could even just be plain old arthritis. Regenerative medicine is a type of medicine that seeks to promote natural healing within the body. In other words, techniques that try to get the body to heal something that it has not been able to heal on its own. In the case of a joint that's painful because of arthritis or possibly because of damage to a ligament or a tendon that might attach in and around that joint, there are 3 different types of injection techniques that we offer that are all part of regenerative medicine. Those include Prolotherapy, PRP injections, and PRP stands for platelet-rich plasma, and then stem cell injections. And in that order, they kind of go from less intense to more intense therapy. Prolotherapy is a type of injection treatment that has been around for literally hundreds of years. It uses inflammation as a natural healing process in the body. Our understanding of inflammation is that it's the natural response to injury. It makes sense if you think that when you sprain your ankle or have any other kind of injury, your body responds with inflammation. Unfortunately, we've become accustomed to treating that with anti-inflammatories. And that's our common mindset. However, inflammation is the natural healing mechanism. So with Prolotherapy, what we do is we use solutions that we inject in the injured body part to promote inflammation so that we can get that body part to heal. When we do Prolotherapy injections, and you have to remember that we are going to be treating the body using inflammation. And so most people know that inflammation does hurt. So no matter what we're treating with Prolotherapy, whether it's a knee or a shoulder, a back, or what have you, there's typically going to be a flare of pain. And it's usually not terrible pain. It's usually very similar to the pain that the person might already be experiencing in that body part, perhaps just a little bit accentuated for a few days. The increase in pain typically lasts anywhere from 1 to 3 days, and then it dies down to a baseline. And then we watch to see what sort of improvement the patient has. Typically they start noticing improvement over a course of anywhere from 2 to 4 weeks. Certainly by 4 weeks we expect there to be some noticeable improvement. With Prolotherapy we tend to repeat treatments about every 4 weeks. And the number of treatments is very individual. It kind of depends on how well the person heals, how bad the damage is, and the body structure that we're treating. Never really seen a need for more than 6 treatments anywhere that I've treated, and many times only 2 or 3 treatments are enough to get adequate healing that the patient feels like they're done and don't need any more treatment. Well, Prolotherapy is sort of the introductory treatment in this regenerative injection technique. So if Prolotherapy is not successful, the next options would be either PRP or stem cell. PRP would be the next step up. Again, that's a process injecting platelet-rich plasma. Physically, the injections are identical to what we would do with Prolotherapy, but injecting PRP instead of the solutions that Prolotherapy provoke inflammation. When we inject PRP, we're not technically using inflammation. Again, we're utilizing the platelets to release growth factors, and so there's a different mechanism to healing, and it's not nearly as painful as Prolotherapy. In fact, very often there's hardly any pain associated with it at all. It still leads to very good healing, and usually better healing, or I should say quicker healing, than with Prolotherapy. The treatment still can be repeated approximately every month, depending on how the patient is doing. Although again, usually we see fewer treatments needed when we do PRP than prolotherapy. Unfortunately, at this point, none of these injection techniques are covered by insurance. So they do get a little bit more expensive as you move up from prolotherapy to PRP and ultimately to stem cell injections. We do have a variety of different ways to assist patients with payment options. And so if these are treatments that you're interested in, I would encourage you not to let finances be an obstacle to having a treatment that could help you. By all means, come on in and we can have someone talk with you about the different ways that you might be able to afford this. The answer to that in part depends on how far from your normal routine you are before we do the injections. Some people haven't worked for quite some time before we treat them, and so we don't expect them to get back to work right away. But yeah, if you've been working and functioning in a fairly normal capacity, we don't really expect any downtime whatsoever from these injections. Thank you very much for taking the time to listen to our discussion on regenerative injection techniques. I hope that this was informative. If you happen to be someone or know someone who might benefit from these injection techniques, I would encourage you to consider coming in to talk to me or one of the physician assistants in the practice. We'd be very happy to see you and discuss these with you in more detail.